So this test we're going to do right now is for ankle and calf and foot function, basically the ankle joint. You have muscles that go as high up into your calf and that go all the way to your toes. The most common reason for dysfunction in any of those areas is those muscles not functioning. Full range of motion means that her toe, big toe, will be 6 inches from the trim of the door. The knee is touching the middle of the trim and the heel is staying on the ground. Things to look for. 1, this heel stays in the ground. The other untested heel can come up. The knee is going over the second toe, so right over the middle of the foot. You don't want to see the foot arch, collapse. You don't want to see the foot rotate out to get more range of motion. Those are all signs of your body borrowing range of motion to ensure this test is better than it actually is. So what this is going to look like from the side is this. May's forearms are on the wall. That toe is going to start at 3 inches away from the wall. So we have a little block here that is 3 inches. Toe goes to the block. She brings that knee to the trim. You'll see that her heel stays in the ground. The other heel can come up. May, how does that feel?
There's no symptoms.
No symptoms. So now what she's going to do is she's going to pull her foot away and she's going to do the test again. How's that feel?
There's a pinch in the front.
So she has a mild pinch. That means that there's something on the back side that is not stretching out, but it hasn't started causing the heel to come off the ground. So I want you to go a little further just so we can see what that looks like. Go for it.
Okay.
Get the knee all the way to the wall. It's all right if your heel comes off. So now we can see the heel is starting to come off the ground and the knee up here, up there, is touching. So we want them both to touch. So she's going to have to slide her foot a little further forward and then we're going to get our read. So if this is the most amount of range of motion, we can take a block here that is 1 inch wide and we can slide it in there. So she has 4 inches of range of motion. 4 inches divided by 6 is approximately 66% function. So she has approximately 1/3 of her function missing somewhere from the muscles and ligaments in the back of her leg. That's it. That's how you measure function. So no cheating. You're bringing that knee straight over that second toe, bringing it to the trim. I advise you finding an area with door trim because otherwise you'll have to account for the depth of the wall trim. So find something that is flush with the floor and measure from there, or at least account for the thickness of the floor trim. And that is how you measure ankle dorsiflexion range of motion.